Hi guys, myself Dr.Sonali. Welcome back to my YouTube channel. How are you all? Hope you're fine. Hope you're enjoying, and may God bless you. May God bless you. May God bless you. Today we will talk about congestive cardiac failure. So, what is this congestive cardiac failure or heart failure? Congestive cardiac failure is a condition when the heart fails as a pump, leading to symptoms like breathlessness, pulmonary edema, ascites, and portal hypertension. What are the causes of congestive cardiac failure? Senility, aging, cardiomyopathy, thyrotoxicosis, diabetes, hypertension, anemia, IHD, ischemic heart disease. These are the causes of congestive cardiac failure. Now, what actually happens in congestive cardiac failure? See, due to the causes mentioned above, the left ventricle starts dilating. The left ventricle, the left ventricle starts dilating because it could not rush the blood from left ventricle to the arch of aorta. As a result, the blood regurgitates into the left ventricle and it starts dilating. But there is a limit to this dilatation. So the blood from left ventricle regurgitates into left atrium, and from left atrium there is a limit to the dilatation of the left atrium also. So the blood now regurgitates from the left atrium to the lungs. As the blood regurgitates into the lungs, we will get the symptoms like pulmonary edema, breathlessness, and there will be marked crepitations will be heard at the base of the lungs. So the symptoms like breathlessness, pulmonary edema, and creps, it comes like this. Now from lungs, the blood regurgitates into the right ventricle. From right ventricle, it regurgitates into the right atrium. But there is limit to this. Blood now regurgitates into the right atrium. But there is a limitation. So the blood now enters the superior vena cava and inferior vena cava. If the blood regurgitates to the superior vena cava, there will be raised jugular venous pulse, there will be orbital edema, there will be headache. If the blood regurgitates into the inferior vena cava, there will be portal hypertension, there will be ascites, there will be pedal edema. So this is how the edema develops in the congestive cardiac failure. But due to all these things, there is a decrease in the cardiac output. As the cardiac output decreases, the blood flow to the renal vessels will also decrease. If the blood flow to the renal vessels decreases, the glomerular filtration rate will also decrease. Hence, the electrolytes like sodium, water, potassium, they won't be excreted from the kidneys. Okay, so there is a aldosterone is released, and this aldosterone will cause renin-angiotensin mechanism will activate, and this will activate the sympathetic activity, leading to increased sympathetic activity, which will cause marked palpitations and will rise in the heart rate. This is how heart rate rises in congestive cardiac failure, and this is how the palpitation develops in congestive cardiac failure. So this was the cycle of this. These are all the symptoms and these are the cycles. Now, what are the drugs which we are used in the congestive cardiac failure? The first are the cardiac glycosides. They are digoxin, digitoxin. Second, diuretics, because there is edema. So diuretics in mild cases we are using thiazide diuretics like hydrochlorothiazide, and in mild to moderate cases we are using in severe cases we are using this thing furosemide, and high ceiling diuretics like furosemide and torsemide. Then we are using vasodilators like arteriodilator, venodilator, arteriovenodilator. What are arteriodilator? Arteriodilator, they are hydralazine, minoxidil, and venodilator, they are nitrates. Arteriovenodilator, sodium nitroprusside. Then ACE inhibitors like captopril, enalapril, and ARBs like that is angiotensin reversal blockers. They are ARBs like losartan, olmesartan. These we are using. Then sympathomimetics like dopamine, dobutamine is used. Then beta blockers are used like atenolol, bisoprolol. So beta blockers are used. Then phosphorus diestrase inhibitors like ambrinon and mildrenon, these are used. So these were the pharmacological treatment of the congestive cardiac failure. Now we will study about digoxin. How digoxin acts in congestive cardiac failure. This digoxin, it acts on the sodium potassium ATPase pump on the cell. So it causes in sodium to release in the cell. Also calciums to release. As a result of this, the sodium and calcium start increasing in the cell as an antiport mechanism, and there is a increase in the sympathetic activity, and there is increase in the cardiac output. As the cardiac output will increase, the renal blood flow will also increase. So there will be excretion of the electrolytes, and there will be no compensation required by the renin-angiotensin mechanism. So there will be no secretion of aldosterone, and the sympathetic activity will be low. As the sympathetic activity will be low, all the symptoms like increased heart rate and palpitations will get reduced. As a result, the left ventricular back pressure is also reduced. If the back pressure from the left ventricle will reduce, the symptoms like pulmonary edema, pedal edema, ascites, portal hypertension, raised jugular venous pulse, then orbital edema, headache, all these symptoms will be reversed. And this reversal of the symptoms in congestive cardiac failure, this sudden reversal of the symptoms in congestive cardiac failure by digitalis is called as digitalization of the heart by digoxin. So this is how digoxin act. The digitalis is more safer than digoxin, but still digoxin is most widely used. So this was about digoxin, but digoxin causes toxicity. It sometimes causes nausea, vomiting, epigastric distress. Nausea, vomiting, epigastric distress is the first sign of the digoxin toxicity. As soon as you came to know that the patient is having nausea, vomiting, this digoxin is to be stopped abruptly. Then in CNS, it causes supraventricular tachycardia, ventricular flutter, ventricular fibrillation, atrial flutter, atrial fibrillation. Ophthalmic side effect, there will be scotoma. What is scotoma? Scotoma is a dark spot in front of the eye due to deposition of the drug in the choroid of the retina. So there will be scotoma. There will be CNS symptoms like confusion, hallucinations, convulsions. So how we will treat this digoxin toxicity? First, stop the drug immediately. Start a KCL solution. Give antiarrhythmic drugs like IV lignocaine, then IV phenytoin, lignocaine, phenytoin and propranolol. Then this was about digoxin. The second choice of treatment in the congestive cardiac failure are the diuretics. So diuretics, what they will do? They will reduce the volume overload and decrease the symptoms. Now vasodilators like arteriodilator, venodilator, arteriovenodilator, they are also used. Arteriodilator, they will dilate the arteries. As the arteries are dilated, there will be decrease in the afterload. So there will be decrease in the peripheral vascular resistance. And in the venodilator, the drugs will dilate the veins, thereby decreasing the preload. Okay, thereby causing venous pooling. Arteriovenodilator, they will decrease preload as well as afterload, thereby relieving the symptoms. So this was about diuretics. The drugs like ARBs and ACE inhibitors, they prevent the cardiac remodeling. So that's why they are using in congestive cardiac failure. Then sympathomimetics like dopamine, dobutamine. What dopamine will do? In low doses, dopamine will dilate the renal vessel. It is the natriuretic effect of the dopamine. It will dilate the renal vessels and increase the renovascular blood flow. 2 to 5 microgram per kg. Then in the moderate doses, it will stimulate the beta 1 receptors of the heart, and it will create myocardial contractility and increase the cardiac output. And in high doses, dopamine will increase the will act on the alpha receptors, will cause generalized vasoconstriction, and will cause rise in BP. What about dobutamine? Dobutamine is a selective beta 1 agonist. It's a selective beta agonist. It will act on the cardiac cells, and it will contract the cardiac cell and increase the myocardial contractility. So likewise, the sympathomimetics are used. So they will maintain the cardiac contractility. So what remain? Then the phosphodiesterase inhibitors, embrinon, milrinon are there. They will also they are also the drug of choice to treat the congestive cardiac failure. So this was about congestive cardiac failure. Hope you like my video. In short, I am telling all the topics, but I cover everything in that: pharmacological management, the pathophysiology, the symptoms, the causes, and in the definition. Hope you like my video. If you like my channel, like it, subscribe it. Thank Thank you so much. Love you all.